new information is expected to come out later this afternoon from Governor Holcomb regarding the state's handling of the coronavirus. Matt is live for us this morning with some of the things expected to come today. Good morning.
Good morning to you. In a way, all eyes here at the State House will be on May, although it'll be a dramatically quieter month of May than what we're used to here in Indiana. Information on your screen shows really the stay-at-home order in the state right now is expected to be extended until May 1st, which is next Friday. However, we are learning that some of the restrictions in place could be lifted. This also comes as we're learning that recommendations from a task force, including businesses like restaurants, on how to best reopen the state, that is due to the governor's office by Wednesday of this week. And we're also learning that part of the state could reopen by a certain region, all in an effort to help stop the spread. Of course, we'll be following what happens here at the State House both today and in the week ahead right here on 13 News, as everyone is hoping the economy and everything here can get back to normal as safely as possible.
All right, Matt, thank you very much. Well, the president says a deal between his administration and Congress to help small business is getting close to happening. And many of those businesses are in desperate need of support right now. All this comes as more and more Americans are calling for social distancing restrictions to be scaled back and for more businesses to reopen. In fact, the governors of Texas and Vermont are reopening some of their businesses today. Other governors say there's still a need for caution.
People are struggling with this isolation that we have, on top of all of the other stressors. But the fact of the matter is, we have to be really smart about how we proceed.
So a new NBC News Wall Street Journal poll shows 58% are worried that easing those stay-at-home orders too soon will cause more deaths. 32% say the U.S. is taking too long and will hurt the nation's economy. Well, one of the keys to reopening the country for business is certainly knowing that a second outbreak could be prevented. And the key to that could lie with a group of disease detectives called contact tracers. A new report from Johns Hopkins Center for Health Security suggests adding an extra 100,000 contact tracers for the U.S. It takes time for these tracers to be properly trained to seek out diseases. States like Massachusetts, Minnesota, and Illinois are already working on boosting their contact tracers. And Pennsylvania, the National Guard there will be helping out at some nursing homes after close to 50 residents in one home tested positive for coronavirus. There's also dozens of medical nurses and medics on standby, ready to provide care to many of those patients. And from New York City, a hospital there has just discharged their 1,000th coronavirus patient. The 46-year-old was in the hospital for over a week and was released to the tune of cheers from the staff at North Shore University Hospital.
And one local school is making an impact in the fight against COVID-19. Meredith joins us from her home. And Meredith, they're helping to design something they hope they never gets used.
Right. So IU Health asked the tech internet world, okay, look, if we need to use one ventilator to support multiple patients in a dire situation, how would we do it and what would that look like? And Orchard School, they're a K through 8th grade school here in Indianapolis. They have a 3D printing lab. And the tech director of that printing lab decided he was going to step up and try to help with this. So he's been printing these prototypes that would help split a ventilator. He's been working with the team at IU Health. And IU Health has a ton of resources. They have their own 3D printing lab, but they say Nate was invaluable in printing prototypes to help troubleshoot.
So we kind of really focus on just having the materials on hand and being able to rapidly prototype things so that they could figure out how exactly we can make the project work as intended.
And splitting a ventilator is not ideal. This would only be used if there was a ventilator shortage here in Indiana, which so far has not been the case. But if it comes to that, if they need to do that, God forbid, they're going to be ready because in part of these 3D printed little pieces that would help split a ventilator that a local school is really helping make, which is so cool, Julia.
It is, boy, impressive times what we're seeing all of these people that are geniuses come up with this time of year. Thanks so much, Meredith. We appreciate